So good morning everybody and welcome to the next edition of A Chat with Caroline. Just a reminder to use the chat facility during the course of the next 15 or 20 minutes with any questions you may have for Caroline and her panel today. Good morning, Caroline.
Morning. Hi everybody. Thanks ever so much for shooting, dialing, whatever it is, that clicking in to this chat with myself. And today, really pleased, very important topic for us. We're going to be talking about service user and carer engagement. And I'll just ask my guests to introduce themselves. So, Maria.
Good morning, my name is Maria Nelligan and I'm Director of Nursing and Quality and I'm the Lead Exec for Patient Experience at the Trust.
And good morning, I'm Lesley Davison and I'm a Public Governor for the Files and an ex-service user.
Excellent, thank you. We'll be coming to talking about service user and importantly carer engagement. Before we do, as usual, I just wanted to update people on some of the key things that are going on across the Trust, if that's okay. Keep your questions coming in while I'm updating you. Really happy to ask any question, answer any question about any topic that people may have. Could be to do with service user engagement, or could be anything that I'm talking about, or anything else this morning. So first thing is to say thank you to everybody for completing the staff survey. Really important that we get the highest response rate we can. We can only continue to improve things, and we really are on a significant improvement journey if we hear from you what's it like to work in the Trust. So we've made good progress, but we've got a way to go. So if you can please spend 10-15 minutes to complete your survey, I would be really grateful. Thank you to everybody. And then secondly, another reminder is to have your flu jab. So as we know, the most important reason that we're having our flu jab is to keep ourselves well, our own health and well-being, and also service users and carers, because we're in the caring profession. So really important that everybody again just takes it's a couple of minutes to go and have a flu jab. We're about halfway there, folks. We're about 40%, I think, and we've got to get to 80%. Also, if we don't get to 80%, we lose a substantial amount of money, and that's money that we could be spending on clinical staff for our front line. So if everybody can please do everything they can to encourage people around them to have this flu jab and have it yourself, that would be fantastic. On a positive note, a lot of people have already engaged with our new Listening into Action app, and at the moment, for the last week or so, we've been running a message on the app around anybody that needs particularly clinical equipment, but it could be other equipment, essential equipment to do your job every day. It's been fascinating to see the requests that have come in, and we might ask ourselves, why is it that our staff haven't got basic clinical equipment to do their jobs? So we really want to create the culture where you guys have the autonomy to be able to do that. But for this one-off opportunity, we're going to make sure that everybody as much the equipment that they need to do their jobs. So at the last count yesterday, I think we had about 220 people that had asked for something. So please do engage. I think it closes tomorrow, I think, or maybe Sunday. In the next few days, it's closing. So again, really important. And thank you to everybody that has. Maria and Lesley will be talking in a moment about our open space for service users and carers that we have on the 25th of November. So I won't talk any more about that. Also wanted to thank everybody for engaging in the development of our new clinical strategy. Really important that our clinical strategy is right at the heart of our organisational strategy. And once we've developed this, our other strategies like estates and digital and people, for example, will be shaped and developed around our clinical strategy. Thank you for Richard Morgan, our medical director, who's leading this and who led the workshop in the last week or so. And please do keep engaging, and we need to continue to hear your thoughts and views. Lots and lots is going on and continuing to go on around our new thoughts, around our new locality structure. On our website at the moment is the next series of workshops. Really important that this is co-produced with staff and that we have a positive experience for people in terms of change and there's a lot of support for moving to a locality structure. We need to really start to now really put the meat on the bones and start to look at what services may be most appropriately placed where. So have a look on the website. There's about 4 or 5 workshops coming up during this month, and get along and contribute. Couple more things from me. We've got new executive director posts that are out to advert. We've got Chief Operating Officer, our new Director of People and Organisational Development, and quite an innovative new Executive Director of Digital that we're also is out to advert. So I think that's good news. It'll take us a while by the time we get people into those posts, but really good progress that we're making. And then finally, a big congratulations to our South Cumbria Learning Disability CAMS team, who have won a National Nursing Times Award in the last few weeks. So really well done to them. I'm now going to hand over to Maria to talk about what are her thoughts, really importantly, about service users and carers, where we are now and where you'd like us to be going forward.
Thank you, Caroline. As some of you will be aware, I've just come new to the organisation. I think I'm 2 months into Lancashire and South Cumbria. It's been a pleasure so far to meet people. However, there's some work that I really want to do in engaging with service users and carers and getting out to hear their views about how we should engage with them on 2 levels, really. One around how we deliver our services, and the other around how we improve our services, and that whole area of co-production. People might be familiar with that term. I guess the third area that I'm keen for us to develop as well is how we can provide employment and development for people with lived experience, and how we can integrate that into the service. We're a big employer, so there's an opportunity for us to really look at how we can do that. From where I'm at so far, I've seen some really good practice, particularly around service user and carer engagement around improvement within teams supported by our quality improvement team. And so that work is really something that I'd like us to really develop and build upon. However, we haven't currently got a service user and carer strategy or strategic plan. And myself and David Eva, the chairman, are hosting a listening event. We're calling it an open space event on the 25th of November, and we've invited service users, carers and the voluntary sector, and it really is an open conversation, an open invite to come and have a conversation with us about how you would like us to engage with you, how you would like us to develop our strategic plan, how you would like us to work with us going forward and taking this agenda forward.
So presumably for people that are listening, Maria, they can invite service users and carers, groups
Absolutely.
that they've got working with them at a local service level?
Absolutely. So we've encouraged our staff, invitation to bring carers, service users, invite them, support them, come and engage with us. I've also asked for people to bring their examples of good practice and the work that they've done, so people can see some of that practice, and we can have a conversation about how we might want to share that best practice across the organisation and really roll that forward.
Just before I come to Lesley, one thing I just wanted to ask you some more about is you talked about service users being able to be offered employment. Yes. And creating more of a career framework. And we had, didn't we, at our board meeting just last week, a lovely service user story, and she brought along her employer, who wasn't an NHS employer, but it was a great example of how they'd been really flexible. And just in terms of a little bit more thoughts around that.
Absolutely. I think it was really excellent example about how an employer used reasonable adjustments to support somebody with a chronic lifelong condition.
Yes.
And it started us kind of thinking and exploring about how well we're doing in the same respect. And so we're doing a piece of work and actually understanding that. But also we have some people with lived experience employed working in our teams, but they're not directly employed by us, they're employed by a third party. So there's an opportunity for us, the third sector, working in partnership with the third sector, but really looking at, and I was speaking to Lesley earlier, saying around, I'm looking at the staffing reviews, for example, in the inpatient areas. So how do we create roles for people with lived experience within our teams, and develop people, and we have access to apprenticeships. So there's an ideal opportunity for us in terms of, obviously I'll be looking at our career pathways for nursing and AHPs, and having people with lived experience is an excellent opportunity for them to come into the professions if they wish, and also how we can enrich the work that we do in our teams. I think is the next step. I was just saying to Lesley that across the country people are doing different things, and what I'd like us to do really is to take from the best, and develop a Lancashire Cumbria way around engagement with service users and carers.
So let's hear from Lesley.
Oh dear. I was so dreading this bit. Like a rabbit in headlights this morning.
You've got so much to offer and help us with, certainly at the board and the Council of Governors.
You're very kind.
So maybe you can just talk about your hopes, and thoughts.
All right,
That'd be
thank
great.
you, Caroline. Hi, everybody. Right, so first, a really positive note for everybody, I hope. I sit at the board meetings. I'm also involved in the Council of Governors. I'm also involved in one or two of the groups, including Listening into Action and so on. And I'd just like to kind of put forward that this is a really positive time. The people who are on the board, Caroline and Maria and all the other directors, there is a real passion for what's going on at the moment, for all the change. It's hard work, but there is a real drive forward. There is a real acceptance that we're not getting it quite right, is an understatement at the moment, but there is a lot of good stuff to celebrate as well, but there is a real push forward. So looking at the service users, which is a term I hate, and carers' involvement, this is a real opportunity to help shape the future of LCST.
Well done.
Sorry,
Quite
the wrong way around. To really, that we are very much aware that there are a lot of people out there that haven't had a great experience. We'd also like to hear from people that have had a great experience, and try and put the two together. So, whether you've used a negative, positive, somewhere in the middle, please try and come to this event. Come and talk to us, come and talk to me, come and talk to the team. And let's try and just, really move forward into a more positive service, which is what everybody is trying to do. And I would like to, they'll shut me up in a minute, I would like to just say a personal message to everybody who is either a service user or a carer. We are at a very kind of crucial time, I think, for mental health at the moment. We've got the future King of England and his brothers happy to speak out about mental health. So it's an excellent time to be doing it, and it's not something to ever be ashamed of. And I think the way to get rid of the stigma that surrounds mental health, which affects both the patients, the carers, the people that work for the organisation, is just to keep talking about it. Let's make it more open. And if you feel that you need help, ask for it. There's nothing to be ashamed of. The people in this room are all as susceptible to it. We've all got mental fitness to look after. And just, please come and help us make this service better for all of us. Thank you.
Brilliant. Thank you ever so much, Lesley. Have we got any questions that have come in at all?
We have, Caroline. So Judy would like to know first, what are the Trust's plans for involving service users and carers in how the Trust service is going to be provided?
Okay, so from my perspective, it's really important that at a clinical services level that service users are actively engaged in how we support them, so it's a real partnership approach. At a team level, that service users will be involved in how teams and services make decisions. And then at a trust level, that really want to see service users helping us in terms of how we set our strategy, how we set our policy, how we decide how to spend our resources, how we decide what our priorities are. So going forward, that will take us a little time to mature to be able to be ready to do that, but really to be actively involved in our decision making throughout the trust, right from the trust board right down to the delivery of care. But Maria and Lesley have talked already about their visions. I don't know, is there anything else you want to add, either of you, to that?
I suppose one of the things that I'm going to be doing is making sure that we invest in supporting engagement within the organisation. So I'll be looking to go out to advert shortly for a associate director for patient experience. So really raising the profile within the organisation up to where it should be. Also, one of the things I found in my past experience that is a good way of really sense checking how well we're doing is an annual event where we have a conversation around quality priorities and how those quality priorities fit with what service users and carers think are important. And that's something I would like to very much be able to do here as well. And I'll probably suggest that at the 25th and hear what people think, because I think there's a key opportunity to make sure that we're connected with people that use the services in terms of what our priorities are going forward from year to year. And it's very easy for us not to do that and just go by what we think.
Yeah.
But I think it's really important to have people that use services and our staff really engaging in what's really important for that coming year to be developed and improved.
Yeah, so it can really help us to decide what our priorities are. Okay.
And I think there's a piece of work I know that has been done before around developing a recovery strategy, we'll talk about that on the 25th. But I think I would be really keen for us to make sure that our staff have the skills and the knowledge around recovery, and what those principles mean and how that is then played out and evidenced in terms of our care plans that are co-produced with service users and carers, and as well as our risk assessments. So at a clinical level, there's work that we will need to do around really making sure that co-production, person-centeredness is a key piece that we live and breathe every day. And I think Lesley mentioned the whole promotion work as well around how we promote positive mental health. I think is something that we need to think more about.
And we were just talking, Lesley, weren't we, about the excellent work that Sam's involved in the schools work, and do you want to just say a little bit about, because that helps, doesn't it, if you start from childhood talking openly about mental health.
Absolutely. Well, a lot of what Sam Tyra does, Caroline's referring to change talks, is about giving young people coping strategies and really resilience. They obviously live, in a different world to our generation. Our generation did. They were under an awful lot of pressure, mainly from the internet. More drugs, more knife crime, all sorts of different things now. So really, the work that Sam does is preventing the problems of the future that we're sitting here discussing now, and that's why that sort of service is, and I think looking at the feedback that Sam's had, people find because it's a conversation that they've started, people, then the parents, the teachers, the peers, everybody just finds the whole thing easier to talk about. Let's get rid of the stigma from an early age and get rid of those, the most awful thing I think that we live with these days is teenage suicide. It's just horrendous.
There's a lot of work to do.
There's a lot to do.
Yeah, but we've got some good green shoots that we can build on. We've got some good recovery work that's already being done. So it's then how we build on that and widespread it across everything. So it's how we do things around here. Any more questions that we've got in at all?
Yes, we do. Mitchell, as a carer, how can I be more involved in the trust?
Yeah, really important. And again, I think we've been talking about service users and carers. And I'll again just hand over to Maria, and she might want to say some more, as Lesley might want to as well.
Yeah, I think we use the term service users and carers in the same breath. And I think both groups maybe have different needs and different wants, and I think we probably shouldn't put it all in the same bucket, really. But we need to make sure that we do not forget our carers. So we have already relationships with carers groups, and it's how we bring those relationships into the work that we do, but also how we support staff to really understand the whole carer support, both formal and informal carers around service users, and that support that they have around care planning and delivering care planning, and making sure that our staff feel confident around that work. And that can only improve by having that engagement with care around what and learning from what works well and what hasn't maybe worked so well. So I think that's we're also doing the triangle of care, and that's something that was developed by carers nationally, and it's a national programme. So I think we need to see how that develops and evolves forward.
And we've got quite a lot of carers groups that want to get involved in helping,
absolutely,
and creating strategy in a partnership way. So I think really very, very important.
Just one more that's come through Caroline from Karen. Says, do you think the trust service can be positively improved through the involvement of service users and their carers?
Well, it can only be positively improved. I'm really, really passionate about partnering with service users and carers. I truly believe that for us to continue to improve and transform, having service users and carers continually challenging, being inquisitive with us, will only help to set the right culture for us. But we need to demonstrate that we're actively putting this right at the top of our agenda as priorities. So I think that's a lovely note to finish on. Thank you very much indeed.
Thank you.
Thank you to people for sending their questions. Keep them coming, because we will still answer them. And thanks very much for joining our chat today. Cheers.